I'm Jake Williams. I'm with SEIU, and we're here at the SEIU Phone Bank in Denver with groups that include CCHI and CPC and others that support the Fair Insurance Bill. Morgan's going to tell you about what it does, but basically what we're doing tonight is calling constituents and connecting them with their legislators to make sure that legislators know that real people care about this bill.
You know, the FAIR Act comes from a need to make sure that we do not pass on any unjustified rate hikes to consumers. In Colorado, we've seen rate hikes as high as 60% in just 4 years, actually 6 times faster than the rate of inflation. We are paying for literally hundreds of millions of dollars of waste in this system, and Colorado has an obligation, I think, to fight back. The FAIR Act is going to give us a chance to go through and make sure that no rate hike can take effect unless it's justified, and give the insurance commissioner the ability to reject unjustified rate hikes and capture full transparency so we can see where our money is going. Tonight here we join a healthy group of citizens that realize that we basically demand to take back ownership of our right to good health care for good quality and for good access, and it's time that we stand up to the insurance industry and make sure that our health is their bottom line.
See what I think?
About upcoming legislation regarding the FAIR bill, which is House Bill 1389. What it does is it essentially stops, allows for rates.
Here we have our Avalanche fan. Hey, the Avs are doing well this year, huh?
They are. Better than the insurance companies, hopefully.
It's UP News on Mile High Sports Radio. I'm your host, Wade Norris. With me today is the Colorado Consumer Health Initiative, Dee Pearson and Monica Griego, and they're working on Colorado's behalf for a House Bill 1389 that would seek to reduce your insurance costs, and it's called the Fair Accountable Insurance Rates. And guys, just tell us about what you do at the Colorado Consumer Health Initiative and what this bill seeks to do for Coloradans.
Sure, the Colorado Consumer Health Initiative is a nonpartisan, nonprofit organization. We're member-based, and we work to bring a united consumer voice to healthcare policy and legislative arenas. And what that really means is, historically, who's really influenced decisions on policy and healthcare have been big money interests: doctors, pharmaceutical, insurance, hospitals. We really try to bring the consumer perspective and voice to that decision-making at the legislative policy process.
I think that's a powerful voice we bring to the Colorado State Legislature. Not having a direct financial interest in the legislation that's passed gives legislators the opportunity to talk to us, meet with us, and understand what the core values are for consumers on healthcare legislation. The FAIR Bill, House Bill 1389, is co-sponsored by Representative Morgan Carroll in the House and Senator Sandoval in the Senate. And the bill does not seek to reduce healthcare premium costs, but actually arrest the rate of growth at which healthcare premiums in our state are spiraling out of control. Our coalition is one that brings together small businesses, providers, healthcare providers, labor groups, healthcare advocates, and research groups. And we've got an extensive list of supporters for FAIR. We will go to the Business Affairs and Labor Committee soon, and we are looking to rally and get the support of consumers statewide to contact their representatives and let them know that this is a bill that really comes from the consumer voice and needs to be supported.
And the bill does a couple of things. It first says, here are sort of good operating principles for what sort of justifies rate increases. Right now, when insurance companies raise rates, they say that there's a cost basis, but it's not transparent for consumers what that cost basis is. And so this gives some benchmarks and guidelines to the insurance commissioner to say, this is what's reasonable. These are criteria, these are reasonable benchmarks. It also gives the insurance commissioners, it moves to a prior approval system, which actually requires them to file it and the insurance commissioner to review it before they start to use it. And then lastly, it provides a lot of transparency for consumers, for businesses, to say, okay, what really is going on here with rates? They're spiraling out of control. They have been for many years. What can we do to sort of try to actually keep rates down? Without knowing what the drivers are, we can't really do that.
One small thing the bill also does is seek to reward top performers. There's a Colorado Consumer Choice Award in the bill that would reward the top performing carrier that spends the most amount of money on actually covering healthcare costs for its consumers, and allows that award to be given through the most recently codified in statute, Colorado consumer counsel?
Well, and basically what this bill is going to do, right now we're one of a few states, there's 38 states that have prior approval, and we're one that does not. And basically, if a health insurance company is going to raise rates, they would have to go through the commissioner and present a case for why they're raising the rates. And as you know out there in Colorado, the Coloradans know, this statistic will probably hit home with you that between 2000 and 2007, health insurance premiums have risen 98% on average. And unfortunately, that means that there are more and more health insurance people going without health insurance. And also, it's making small businesses less competitive in Colorado. And that's a domino effect. Once you start making it harder for small business to operate, then you start making it harder for people to be employed gainfully and for the economy to grow robustly. And so it kind of hurts the free market system. So if you're coming from either a market approach or just an individual approach that you want cheaper health insurance or accountability of your health insurance, this bill makes sense. And do you guys have a website or something like that people can go to?
Absolutely. The Colorado Consumer Health Initiative has a website at www.cohealthinitiative.org. That's cohealthinitiative.org. And I'll also mention another website. It's not ours, but if you're interested in taking action on this and sending a letter directly to your legislator, you can go to www.progressnowaction.org/FAIR, F-A-I-R. And there's a petition there that folks can sign to really send to their legislators and be heard on this, because the thing that moves legislators so much is personal stories from people in their districts, and everybody's got a story about healthcare.
Great. And I'll add one number for you guys out there. If you're interested in calling your state house representatives person or your state senator, call this number, 303-866-2904. 866-2904, and ask for your state house or state senator representative, and ask them to please support the FAIR bill, House Bill 1389, and it stands for Fair Accountable Insurance Rates. You'll be doing the state of Colorado's economy a favor, and you'll be doing yourself a favor, because it will put an end to the endless rate hikes without any kind of counterbalance or transparency.
And without understanding really what is going on, I think that you shouldn't have to buy things that you don't understand the basis for or what you're getting.
Right. I mean, if you just consider the price of a hamburger increasing from 2000 to 2007, a whole 98%, I think consumers would want to know what's the cost driver behind that.
Right.
When we're talking about healthcare, it's just as important, if not more. People's lives truly are on the line.
And people's lives truly are on the line.
They are, and we have many stories like that. We also, we collect consumer stories through our story bank, so you can also contact us if you have a story that you'd like to tell us, because we use those stories at the legislature, and we use them to create policy, to say, okay, we see a problem here because people are calling us and this is an issue, creating legislation and policy out of it.
And I want to thank you, Wade, for bringing up the economy piece, because it's so important that people understand that in Colorado, the rate at which small businesses are dropping out of the insurance market and declining employer-sponsored insurance is growing faster than the national average. So truly, in Colorado, we're seeing less small businesses going in and providing their employees with employer-sponsored health insurance, and we know from our growing number of uninsured in the state that we're approaching a crisis level. 84% of the nearly 800,000 uninsured we have in the state are members of working families. We believe Colorado can do better, and we believe this bill can take us there.
Well, guys, I want to thank you for being on the show.
Thanks so much.
Thank you.
Thanks, Wade.
And we're here with the Colorado Consumer Health Initiative, Dee Pearson and Monica Griego. I'm Wade Norris of Ultimate Politics. As always, you can email me, wade@ultimatepolitics.net. And this is Mile High Sports Radio, 1510 and 1570 AM. And thank you for listening, and we'll be right back.